This video will demonstrate the fabrication of a custom-fit bleaching tray with reservoirs. We will be using a stone model of the dentition. Since it will be placed on a vacuum former, we do not need a base for this model. The model can be in a horseshoe shape as demonstrated here. Excess stone must be trimmed from the alveolar ridges using the model trimmer. This will help the vacuum former to adapt the tray material closely to the teeth. For the maxilla, a hole can also be drilled in the palate. The trimmed models should look like these. Apply blockout resin to the facial surfaces of the maxillary teeth only. This is to avoid orthodontic forces on the mandibular teeth. Squeeze out a 1 mm thick layer of resin on each tooth, but do not cover the entire tooth surface. Stay 1 mm away from the gingival margin and avoid covering the incisal and occlusal edges. Avoid filling the interproximal surfaces. Use a fine brush if necessary to spread the resin. You have unlimited working time to apply the resin because it will not set until cured with the curing light. Cure the blockout resin for 10 seconds per tooth with the curing light. Protective eyewear must be used while curing. After the curing is complete, wipe the resin with a damp towel to remove the residue. Center the model on the vacuum former. Lift the frame and insert the tray material. Clamp the frame shut to secure the material. Swing the heating element into place above the tray material. Turn on the heater. While heating, do not touch the clamp area with your hands. Allow the tray material to heat until it sags to 1 inch below the edge of the frame. Immediately turn off the heater and swing it away from the tray material. Turn on the vacuum and push the clamp down onto the vacuum and leave for 30 seconds. Air pockets and folds can be pushed out using a damp paper towel and your fingers. Do not touch the hot tray material directly with your fingers. Allow the tray to cool for 1 minute. The tray can also be cooled under running water. Using a pen, trace the line of the gingival margin on the facial surfaces of the tray. Do not trace above the gingival margin. This will be the cutting line. On the palatal surface, draw a straight line at the gingival margin. You will not be scalloping these edges. After removing the tray from the model, cut along the pen lines using the curved scissors. Scallop around the papillae. On the palatal surface, cut along the straight line at the gingival margin. Check that all the edges of the tray are smooth. Wipe off the pen marks with alcohol-soaked gauze. Spray the tray with disinfectant and rinse well before trying in the patient's mouth. When the patient is ready to use the tray for bleaching, a dot of bleach is added to the facial surfaces of the tray. More bleach material does not result in faster bleaching. In fact, it can result in gingival sensitivity as the excess bleach is pushed out apically.